Welcome to the office.
Thank you, sir.
So today we had to switch roles today. Why? Because he's come from up north, and I asked him to sit, but if he sits for
10-15 minutes.
What
Right
happens?
now, the switch on, the pain just starts like from here and then
what
goes
kind
to
of
the back.
pain? Is a burning
It's
pain?
burning and then cramping, just right here. And then
Okay.
it goes all the way to my back,
Okay.
and then to here, and then here.
Okay. So you're here today for burning pain down your left leg. How long have you had this, sir?
For current period, I had it for like more than two months now.
2 months.
Yeah.
When did this start?
So the story is like I'm having the back pain for like more than 10 years.
Okay.
But then it was like, it comes for like 1 or 2 weeks and then it goes off.
Well, let's
like,
rewind. What happened 10 years ago, sir?
As far as I remember, like I was trying to get something like from the bottom, just to grab it and then just oops, and then it started.
So you bent down to
Yeah.
lift something.
Yeah,
Was it
lift
a
something.
box?
Box was just a
Something?
cup, like a light cup.
A
heavy.
light cup.
Yeah.
10 years ago. I just
In
want to
the
be
morning.
clear.
Yes.
I'm being a little I'm being very straightforward with it so I can understand what happened.
Mhm.
So 10 years ago, you went down to pick up a cup.
Yeah.
And your back went out.
Yeah, and then as soon as I got up and then I was like oops, and then
You had a spasm
it kind of
and it was a sharp pain.
sharp pain. Back then, yeah, sharp pain in my lower back here.
Did it go down into
No,
your leg? So
no.
back then it didn't.
No, it was only in my lower back.
He said 10 years ago he went down to pick up a cup and his back went out. Is that logical? No. It means, and I need us to understand the difference. I need all of us to understand the difference.
Mhm.
Process versus event.
Event.
So that was an event that triggered a process that was already occurring in the body.
Mhm.
Right? So let's rewind further than 10 years.
Mhm.
You had any major slips, falls, traumas, car accidents you remember?
Mhm.
Do you remember anything more?
Nothing, just the
Life
biggest-
as a kid?
Yeah, that's right.
Okay.
And
Here or
nothing-
back home?
No, here.
Here, okay. All right, now from that 10-year period,
Mhm.
that initial thing happened, you had back pain.
Yes.
From there, did you do anything for it? Did you see anyone for it? You just dealt with it?
I just went to like ER back
Okay.
then, and then the doctor, they took X-ray,
Okay.
and then she did fine. She just gave me a book to do the exercises at home, and then it went after like two or 3 weeks. Then I was fine, normal.
Okay.
Yeah.
So then you readapted to whatever was going on.
Yeah.
Take it. Okay, now let's move forward from there, please. So
And then okay, and then it used to be, I used to be fine all the time. Just it came like after 3 or 4 years once, then after 3 or 4 years once, and then it used to be only in the back, so nothing bigger at that time. And then, but last year I had the same issue, like I had the back pain. The same thing I was doing, like bending something at my house, and then I bent for like, say like 10 or 15 minutes, and then again the same problem. It started like the nailing, the shocking pain, and then it started like in my leg.
So the leg started last year.
year.
Take it. The leg started, so it started as a burn or a shooting pain?
Shooting pain.
Okay, from the back specifically, it started in the back and went down behind the thigh.
Behind the thigh.
To where?
To here.
It did not pass the knee.
No, last time. No,
It
last
stayed, the first time
Yeah,
it stayed at
time.
the knee.
Yes.
Okay, then what happened?
And then I went to chiropractor, and then
They took x-rays.
they did, yeah.
They told you what your issue was.
Not much. They said the X-ray is fine, perfectly fine, and then they said the nerve must be like like stuck in somewhere, like pinching somewhere in the lumbar.
Did they
And-
tell you which nerve?
The sciatica, that's what. But nothing much, nothing much.
Right.
But
So sciatica is not a nerve number, okay? Sciatica is actually a symptom. Because when you're looking at sciatica, and I've talked about this in past videos, the sciatic nerve is formed by a bunch of different nerves.
yes.
But I was also the case where my sciatica was coming from my neck. I don't know if you watched any of those videos, but I talk about it where I was the patient and I had a third cervical that was causing sciatica for a month and a half.
I guess, yeah.
So anything can cause anything, yeah? All right. Okay, so a year ago you started getting sciatica. You went to the chiropractor. They took some x-rays. They said you have sciatica.
Yeah.
Did they tell you what number, what level, what your issue is, or?
I think there was said like L5, nothing much after that. It's L5. I tried different chiropractor, and then after like 2 weeks or 3 weeks, 4 weeks, so it started like going down and
Okay.
getting better.
Good.
And then it got better like after three months. Then I got like totally fine.
Okay.
And then I used to do the physical therapy, all these things.
Okay.
And then suddenly, this time also, like 2 months ago, so same thing. I was bending. It's my mistake. I shouldn't have bent, but I was bending, like doing something, and then I got up. And the same thing started again. But
Okay.
this time it was like to here,
Okay.
the pain, and then it was
So
burning
this time it passed the knee.
past the knee. Yes.
Okay. Did you go back to the doctor?
Yes.
And what did you say, or what did they say?
They say so. Back then, last year I had the MRI taken,
Okay.
and then they said like I have L5S1 bulge disc.
Okay.
So
Did they tell you how many millimeters? 3 millimeter, 2 millimeter, 5 millimeter, 100 millimeter? I'm joking. Sorry.
I don't know. I think it is there in the report, but I don't remember.
Did you bring the report?
Not really.
And the MRI was taken when?
Last year.
Okay. Yeah, that's fine. Okay.
And
What
then,
else?
Then after like trying chiropractor this time, acupressure doctor.
So that was then. And then
Yeah.
this time, what did they find? It was the L5S1 disc
Yeah.
on the
Yes.
MRI.
Yes. Yes.
So was the treatment different or same?
Same. So then trying all those things, and then it was getting worse. Then I thought like trying, the medical doctors.
Sure.
So I went to the spine specialist, and he saw everything, the X-rays, and he said the X-ray is fine. And then by looking at the MRI report from last year, and he said like, okay, so it's the bulge disc, and try the injection, the steroid. So I had no choice. The pain was really bad, and then I was like, okay.
So you took the cortisone shot.
Yeah, cortisone, like I think
When was that?
it's 2.5 weeks ago.
Oh, that's recent.
Yeah, recent, yeah.
Oh.
So
Did it
I
help?
had
Did it work?
no, not at all.
2.5 weeks ago, you had a cortisone shot,
Cortisone shot.
L5,
Alpha.
based on an MRI that was lying down.
Yeah.
Okay.
But it never helped. So
Not even for a day or two?
no.
What did the doctor say then?
Then I had an appointment with him last week,
Okay.
and then he said, so if the injection did help out, and then the last thing is to get a surgery.
What surgery? Fusion or
I think-
discectomy?
I don't know what's the name, but I think they shaved the disc. I think to make.
They shave the bulge out.
Yeah, the bulge, yeah.
It's usually it's a discectomy.
Or discectomy.
All right. So we have some things to figure out.
Yes, sir.
Is there anything else I need to know?
I think that is pretty much.
That's the
yeah,
number one
yeah.
reason why you're here.
Yes.
And while you've been sitting this whole time, any burning in your foot?
Not enough.
Your leg, I mean? Is
Yeah,
it
the leg,
burning?
yeah,
Is
yeah.
it burning right now?
Yes.
You do feel it,
Yes.
but you can still sit.
Yeah, I can tolerate it. Yeah.
But if you're sitting low, you cannot.
Yeah, I can, but it's like burning. It's more than.
So, ek minute, Koba, wait a second. How did you get here?
So
You drove.
no, I was laying down in a car on a bed, so I couldn't even sit on.
You
the
were
passenger.
lying down flat in the
Like
back.
that.
Wife was driving.
Yeah, she was driving.
And you drove how many hours flat on your back to get here?
It's almost 6 to 6.5 hours.
Okay. So I appreciate you coming out,
Thank you, sir.
and let's figure out what we can do for you.
Thank
Okay. We're gonna go over your X-rays first. This is a picture in time.
Yes.
Yeah. This tells me how you've evolved from birth. I know you're coming here for this low back or this sciatica type symptom, but we want to look in everything in its entirety. And let's go over this first.
Sure.
We have 24 bones in the spine,
Mhm.
23 discs in between,
Okay.
24 movable bones in the spine.
Mhm.
And we have the foundation of this structure, which is the sacrum and the pelvis. So think of this as a 24-story building.
Mm-hmm.
This is the foundation of your building.
Mm-hmm.
In order to have a stable building, you need to have a level base and foundation, right?
Yes.
And you're coming in complaining of, I got low back pain, L5S1,
Mm-hmm.
and you're telling me that they found a herniated disc at L5S1, which is the first floor of the building.
Mm-hmm.
Yes?
Yes.
Okay. Well, we need to go a little deeper right now
Mm-hmm.
and see what's going on here.
Sure.
So I just almost finished the analysis. We're going to do left side, 231, 229. So we have a PI 2 EX3 tip. So let's explain what we have going on based on the numbers here. We have a PI2 EX3 on the left and a P4-L. So let me explain what this means first.
Mm-hmm.
Okay, so the way the pelvis works, right? They work in opposite. One goes up, the other goes down, one goes in, the other goes out. You've heard me say all this stuff.
Yes.
Let's go over your case. You have a PIEX, so the left side
Mm-hmm.
goes down a little
Yeah.
and opens out.
Mm-hmm.
So it's favoring slightly to the right side.
Mm-hmm.
Your body wants to go right,
Right.
but your sacrum on the left is back this way.
Mm-hmm.
There's the disconnect in the left SI joint. Deco. The pelvis foundation is going this way, the other part wants to go that way.
There we Yes.
So that's the disconnect first here, not here.
Mm-hmm.
Does that make sense?
Yes, that's the base.
If we don't have the foundation here, your first floor doesn't make any sense.
Yes.
We have a PI EX with a rotated sacrum on the side. The book says, chapters, Gonstead Chapters, page 43 of the chapters.
Mhm.
It says if you have a PI EX on the side of a rotated sacrum, do the pelvis first. Then do the sacrum.
Mhm.
However, we have a little twist in your case.
Okay.
If we look closer here, okay, deco, we have a slight bend here
Mm-hmm.
of the tailbone, okay?
Mm-hmm.
It goes like this.
Oh yeah.
Do you see that?
Yeah, I see that. Yeah.
And then I see something open down here. So I'm not sure I'm not sure we're gonna start there just yet. Let's go to this one here. And we should have a smooth arc of the tailbone. We have a little nub here, okay? I know it's dark. I'm just showing. There's a kink here in your tailbone.
Okay.
So I know you had some trauma down there.
Mm-hmm.
Okay, sir? So based on what we find, if I find something down low here, that's where I'll start.
Okay.
If I find it in your left SI joint, we're going to start on the pelvis first.
Yeah.
Tick?
Tick.
And you're telling me, here's the other thing, the other clue. You're telling me it went down to the knee, it didn't pass the knee.
First one.
First time.
Yes.
Typically, when we hear that, we have the pain, it goes and stops at the knee. Typically,
Mm-hmm.
it's usually a pelvis issue.
Okay.
If it goes past the knee, it's usually spine, more spine.
Okay.
Tick, you have both. And I
Yes.
believe the pelvis started the process.
Mm-hmm.
But again, if we have an old tailbone injury down here,
Mm-hmm.
we'll figure that out.
Okay.
Tick? Okay. So let's go over here now and let's go to the level foundation. And these are the things that I found based on the level foundation, okay?
Sure.
With this being our foundation, we have a little bit of inferiority of the sacrum here based on the tilt.
Mm-hmm.
I leveled that off and then we started to see we have a potential at 4L. We have a potential at 12T. We have a potential at 6T.
Mm-hmm.
We have a potential at 3T. And then we have something hiding up in your upper cervical.
Oh.
Up top, left side, left atlas, or C2.
Mm-hmm.
Okay? And I'll find it when I examine you. Okay. Can I continue, sir?
Sure.
Here's the other catch on your case. I'm going to erase this. There. Now, you're okay standing? You need
Yes.
to move? Okay. Something just ain't right there.
Mm-hmm.
And I'll tell you what happened.
Mm-hmm.
You actually have an L5 spondylolisthesis. spondylolisthesis. A spondylolisthesis means L5 has gone anterior to both fore and sacrum. And I'm going to outline it for you so you can see it better. This is the back of 4, okay? This is 5. Dejo. And this is the back of sacrum. This has gone anterior. It's a grade 1 spondylo. I don't know if anyone told you that.
No, they say the X-ray is always pretty good.
You have a grade 1 spondylolisthesis is what I see. The fix of this, we fix it. Gonstead doctors is very specific. And L5 is different from a spondy, is different from a base posterior sacrum. Completely different adjustments.
Okay.
Very subtle. I will explain it as I go through.
Sure.
But you have an L5 spondy. L5 spondy doesn't mean we're on L5. If we're on L5 and push it forward, it gets worse.
It gets worse, yeah.
So the correction, which is interesting, is exactly where I circled.
Yes.
S2 is going to fix it.
Fix it. Yeah.
Do you see that?
I have.
Tick. Let's go back here and continue. So we have a spondy, we have a rotated sacrum, PIEX, something down low in the tailbone, and then we have these issues going on. Okay?
Yes, sir.
Now I need to continue. We have, this just doesn't look right to me. This is where your instability is. And by the way, no offense, but nothing was fixed. You were managing your issue.
Yes.
It's like this. I'm scared of your bracelets. Can I see your hand, please?
Yes.
There. Let's say I have a rubber band, or let's say even your bracelet. I love these bracelets, by the way. Okay. It's heavy, right?
It's heavy.
But you don't feel it after a while. Why?
Yeah.
This is actually good. I was going to use a sample of a band. What do you call this?
Kada.
Kara. Kara. And this for looks?
No, it's religious.
So the kara is heavy. It's not light. And you have it on and you feel it.
Yeah.
But then what happens after an hour or two with your
You
day?
don't feel it. It's just regular.
Your body adapts. It's similar if I do this. If I put a rubber band here, you're going to feel it initially. Then the body does what?
Yeah, it doesn't feel anything.
The body adapts.
Adapts.
Right?
Yeah.
So you've kind of adapted of what's going on here. Now, when you had your issues, whatever they did, you adapted to the issue. And as soon as you stopped, what happened? Everything came back.
Yeah.
Right?
Yeah.
Now, here's what I need to show you here. So we know spondy L5 went forward. 4 is looking, it's a little off there. It's almost like a little side shift. And then we have the scar tissue there. It's a little scar tissue there. Take it?
Yes.
So let's figure you out in terms of where we're going to start today.
Sure.
There's one other thing for your neck on this x-ray. You have a T2 side slip. That was a trauma, whether it was a slip, a fall, a hit, sports, whatever it was here, something it hit this way. Okay? Now on this x-ray, and I give you all the good news. On this x-ray, we're designed to have 60-degree reciprocating curves. So even though with the traumas and everything, your discs are great.
Okay.
Your discs are all good. This looks worse than it is because it's tilting. You're looking at the undersurface. Discs are fine. Discs are all fine. 7 is a little less. 7 is a little bit less.
Okay.
But overall, it's still good. Okay? The thing I do want you to understand is you need these curves. We need a little more curve in here.
Okay.
Tick? And more importantly is you're getting the reverse curve here. So we need to help focus and guide you to get this curve back.
Okay.
And right now I just have one thing for you to do while you're here is walking.
Okay.
That's it. You're okay to walk, right?
Sure.
It doesn't hurt to walk.
No, yeah, I can tolerate it.
Yeah. And I'll give you something to bring the inflammation down, some ice and things like that. Okay. Either 7. But 7 I wouldn't be messing with if we have this. Okay? Now, last thing I want to talk about is there's a slight anterior carriage. Slight. It's very subtle. And it's not a lot. Deco. So you should be here like this. This curve should bring the C2 back here. We're about 10 degrees forward, right?
Yes.
Not so bad with 10 degrees.
Mm-hmm.
The research shows for every 1 degree forward, it's like an extra 10 pounds on the lower cervical spine. So you got a little tension here because of that anterior.
Okay.
So the idea is we want to help get this posture back.
Sure.
Plus, questions?
No.
I know I talk a lot. I like to give all you as much information as
it's
possible.
really helpful. Yeah.
Take it. Has anyone ever explained any of this to you?
No, not even 1%.
Do we want to talk about your digestion?
Mm-hmm.
It's bad too.
Maybe.
I'll save it for later, but you see this? This is ascending colon transverse descending.
Mhm.
That's your Megan Blvd, should be half black circle. This is the permeated moth appearance. You're not absorbing as efficiently as you can.
Mhm.
You're producing a lot of gas. By the time it comes down, you got a lot of gas there.
Okay.
Take it. I'm not giving you anything for it.
Mhm.
Okay? I just want you to start noting any differences I'm going to ask you after tomorrow.
Sure.
Take it?
Take it.
Let's go ahead and let's see you walk. Now, let's turn and just check. March in place, please. March in place. March in place, sir. Thank you. Yep, march in place. So this whole thing is swollen and stiff here. Stop. Okay, so when I look at his sacrum, he's got a puffy sacrum here. It's more swollen here on this left side than it is on the right side. Now, I'm going to mark your dimples before you walk. Okay, sir, I want you to walk over towards the nervous system poster and back. And let's watch. Those dimples should move up and down. Ain't nothing moving, dude. Those dimples aren't moving. Keep walking. Several times back and forth. You're walking like a tree, sir. No pun intended, I'm sorry, but there's no movement in your low back. Keep going. Yeah, that left ain't moving at all. Keep walking. So those SI joints aren't moving, so whatever's happening is you have a lot of compensation and you can see it in your legs. He's flat foot with bilateral pronation issues going on. And his posture, like when we look at the x-ray versus his walk, do you have to hold your leg to walk right now?
Yeah.
You do?
I can try without it.
Can you try once without it? And I just want to see the walk. Yeah, see? So now you can see him kind of waddle side to side now. Take. Okay. Have a seat, sir. Okay, let's start with the scopes. Base of the neck, and there it is. First one, 10 points, C1, C2, left side. Oh, 15 points, sir. T2, T3, left side. Oh, you're going to make me work today. Good. That's around T12. Same left side. 12, 15 points. You want the good news and the bad news?
Yes, sir. Good.
You have a lot of pressure down here, sir, but it's
Yeah.
not your L5. It's S3, S4.
Oh.
It's down low. Look, I made a happy face. देखो खुशी रखे बाबा खुशी रखे बाबा खुशी चाहिए ना
Yes.
खुशी खपे Oh, one day I'm going to do a video with my daughter. She's dancing her Bhangra.
Bhangra?
She loves Punjabi music. That's all she listens to, by the way. The other parts she won't listen. Okay. Static palpation, starting at the base of the neck. Let's round your back a little bit, please. Forward. Round. Bas. And let's see what we find here. Up a little. 1, 2, 3 more tender or 2 more tender?
2.
3 or 2?
2, I think.
2 is the side slip. Okay. 2. You can see as we get right about there, it goes and sucks in right at T12. More tender there or there. Bottom or top?
I think the top.
Okay, relax there, breathe. Head down, please. Let me feel what I see. That one right there. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Bar. 12, 2. Feet together. Scoot forward, please, a little bit. Your feet are touching the floor?
Yeah.
Okay, feet together. Open and close your knees. Go forward a couple of inches, please, sir. Excellent. Feet together. Open and close the knees, both of them. Open and close. Good. Left side only. Right side only. Nothing's really moving, dude. Left side only. He can move his hips, but there's no real action going on down there.
Mm-hmm.
You're very rigid, right? When you walk. You're stiff, very
Yeah,
stiff.
stiff.
Sit back. Pitch out. Thanks. All right. Starting up top at L5. Back towards me. Ye panch hai. Panch or ek.
Ek.
Ek or do.
Ek.
Ek or teen. Teen, do or ek. Teen. Do
Do.
or ek.
Do.
That's a little more consistent with the spondylolisthesis, okay?
Mm-hmm.
So we have an S2, which is part of the spondy. We have a T12, we have a T2. And now, sit back for me, sir. And let's check the neck.
Mm-hmm.
It's okay, I'm gonna mess you up a little,
Sure.
mess your hair up a little bit.
Sure.
इसका नाम क्या है?
Turban.
No,
Pug.
pagri.
Pug.
Pug. I know it's a turban. You know it's a turban. I'm looking for the other name, sir.
Yeah, right there.
Right there.
Yes.
Okay, so here's what I want you to notice.
Mm-hmm.
He's complaining when I push on his C6, but there's no pressure there.
Mm-hmm.
But it's a good test for when we're done.
Mm-hmm.
Okay, to test it. 5, 4, 3. Ye do hai.
Mm-hmm.
Ye ek.
Mhm.
Ah,
Yeah.
ek. Ek. Do. Bar.
Mm-hmm.
Do. Ek, do, bar, do.
Bardo.
We found C1 on the left.
Mm-hmm.
T2. T12.
Mm-hmm.
S2.
Okay.
We got 4 areas. I'm going to start where? Penthouse and basement.
Okay.
I'll have you walk after that, and then we'll figure out where we're going to go from there.
Okay.
Sound good?
Yes, sir.
Slide to the left a little bit. Bas. Left hand up. I'm putting a seatbelt on.
All right.
Slide to the left a little more, please. Good. Take. ASL. Now, we're going to be right on the left atlas. Nice and easy, sir, please.
Okay.
Left here, nice and easy there. Getting a soft pinch of the SCM to be on the anterior aspect of the SCM to get right on the atlas. The tubercle of the atlas on the anterior. Gotcha. That's a piece. Turn your head to the left. Good. And let's get a little more of the atlas. C1. Home run, sir. Gotcha. Head down, please. And just walk twice back and forth. We'll see if anything changed from just that. Anything different from that?
Did a lighter from
At the top?
Yeah, at the top, yes.
All right. S1, S2. So I'm right on S2. We're going to bring sacrum under L5. So it's a scooping action underneath. Slide up a little more, sir. A little more, sir. Thank you. Good. Scoop underneath. Relax your shoulders. Ah! That's a little bit. Gotcha. I know. It looks worse than it is. Hold on like this. March. Walk. Regular walking. Regular walking. It's different right now, yes?
Yes.
Yeah. Right side. Bottom leg straight, top is bent. Slide forward, sir. Bus. Over there. Good. So same thing, I'm on S2. Spondy, the only difference is I'm torquing down. Down. That's the home run, brother. Come on up, please. Let's walk that up. Bolo? More pain, less pain, different pain?
I think a little less pain
Okay.
than walking. Again, the walking.
Okay. You are walking less guarded, I'll tell you that. Come back over here, have a seat, let's continue. Starting at the base. C1 is clear. T2, 3 is clear. We don't need to touch that today. 12 is still there. And sacrum is clear. Now, I want you to feel this before we can. All right. Back slowly towards me. Here, Panche. Teep? Good?
Yeah.
S1. S2. Different?
Mm-hmm.
S1 is moving now. S2. S1. Good. All right, sir. Let's go back on the high-low and do your T12, please.
Okay.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 5, 4, 3, 2, 1, 12. Good. And that's the home run. Walk slowly, please, and let's get a couple of walks in. And let's watch his dimples. We should see those dimples moving now. Ha,
Yeah.
sir.
Moving good now.
Your dimples
Yeah.
are moving, sir.
Oh.
Turn around. Meaning your pelvis is moving now, sir.
Mm-hmm.
Good. Okay, go ahead and walk now, please, again. What's different for you right now as you're walking?
I feel like something's moving in my back here.
Something's what?
Like my pelvis, I feel like it's moving right now.
You feel the movement
Yeah, the
in your
movement, yeah.
foundation. Good. Is the leg different right now?
Yes. Only the burning pain is still there, but I think it's.
Have a seat over here. Starting at the base of the neck. Neck is clear. Mid back is clear. 12 is clear. Sacrum is clear. Can I continue, sir?
Sure.
Shoulders, let me do the work. Pass it, don't help. Down. Bus. Don't help. Kan.
Mm-hmm.
Kan. Bas. And I'm going to start on your talus, right? Your ankle bones, both sides.
Okay.
We're going to use the speeder board to start. I don't want to yank on them because of the work I did on your sacrum today.
Okay.
Straighten out your legs. Raise your right leg, please. AS talus, medial tid. You feel that?
Mm-hmm.
Raise your left. It's different. Burns there.
Yeah.
Bend the knee. Are you okay with that?
Yes.
Any burn?
No burn, only pain in the lower back.
How about there? Burn?
No.
Sit up for me, please. Any questions for me?
Not yet.
You understand everything I found?
Yes.
Let's check your hands now. Stand up, please. Squeeze my hand. Squeeze hard. Dabao. Jorti dabao. Good. Jorti. Awesome. Good. A little bit here on the radial head, on the elbow, outside. Bas. Posterior lunate. Bas. Posterior lateral scaphoid. Squeeze. Good. Squeeze. This guy's got power, dude. Relax. Double. Yeah, but you're still out a little bit, right there. Torice. Bas. Lunate. Bas. Squeeze. Solid. Squeeze. Next visit, we'll deal with your jaw and nose, okay?
Okay.
You good with everything we went over today?
Mm-hmm.
You understand now what your issue is?
Yes.
Take? Okay. Your homework is simple. Water, walking, ice.
Perfect.
You're going to get some ice.
Okay.
Go for your walk 15-20 minutes before you get in a car.
Okay.
And then you're here for the week.
Oh,
So let's see what happens along this journey this week.
Sure.
Okay, sir?
Got it.
Welcome to the office.
Thank you, sir.
You're welcome.